Okay, Marisa, you're good to go.
Okay, thanks, Ambro. Good morning, everyone. I am going to be brief. I just wanted to pass along a couple things that we've been working on with WIC stores. Um, so we always know that fruits and vegetables are a little tricky. So we've spent a lot of time the past few months doing some increased training with stores on how to map their produce and how to improve the shopping experience. So we created a training guide. We've hosted question and answer calls with stores. Our last vendor bulletin was focused on mapping. And then when we go out in store monitoring this year, we're going to do a lot of testing, fruit and vegetable testing. So I just kind of wanted to pass that along because I know you guys hear from your family sometimes fruits and vegetables are hard. We're working on it. It's always going to be a kind of a continual, ongoing work in progress. But just wanted to let you know that. And then my other quick reminder is just, I think this happens a lot in rural stores, but if you have a family that needs a special order, it's always okay to just ask the store manager if they'd be willing to order that product in for that family while they need it. So that's an option, and it is something stores don't have to say yes, but a lot of times when you ask, they will work with you and do that. So those are my updates from the vendor team. Thank you.
Thanks, Marisa. Okay, so our next topic is searching for participants in Whisper. Um, Camila has reported that there's been an increased number of phone calls about duplicate accounts in Whisper. And I know that Brianna and I both have gotten quite a few of them when we've covered help desk as well. So we wanted to go ahead and address the importance of asking questions and searching for participants before adding new people to Whisper. And I know this is something that comes up every once in a while, and many of you have probably heard us talk about before. But it is worth mentioning again because it's coming up a lot and it is taking up a lot of our time. And I think that it's probably causing confusion in your clinics and for your participants as well. So I want to go ahead and just kind of explain what happens when duplicates are created, some of the issues that it causes, and how we can try and mitigate this as much as possible. Um, so I'm going to talk about several reasons for using the same account every time a participant returns to WIC, but I do want to note one exception, and that's if a participant comes in as a woman category, which they could be 12 or 13, but if they're coming back as pregnant, breastfeeding, or postpartum, and they were previously a child participant, they do need to have a new account as a woman. So if you do search for them and you find their child account, that is the only time that we really want to create a new participant account instead of using the old one. Um, for every other scenario where a previous participant returns to WIC, we do need to do our best to find any previous account that might be in Whisper. So the primary reason we want to use the same account every time a participant returns to WIC is continuity of data. Duplicate accounts make it more difficult to track participant history. And I'm going to talk in a few minutes about what actually happens to these accounts. But creating a new account can basically cause past information about the participant to be lost unless staff know how to look for it and that it exists. And even then, it can be a time-consuming process to search out those past records. And occasionally, the state office receives subpoenas for participant information, and it can make it difficult for us to make sure we're actually getting all of the information that's there if we have to dig around a whole bunch of accounts and search for old data. So the next reason that we want to avoid duplicate accounts is the confusion that it can create for participants. This can happen in several ways, but a big one can come down to their EWIC cards. Recently, we had a situation where a participant called the customer service line to get a new card, and the representative pulled them up, found them in their system, replaced the card, and then later we found out that the local agency had added a duplicate account in Whisper, and sorry, I lost my spot. And so they when the customer service representative went to pull up the account in their system, they found the account, but the account that they found actually had closed participants on it. So they did replace the card, um, but it was for an account that didn't have benefits. So when the family received the card, they went to the store and they couldn't use their benefits because there was none associated with that card. Because there were duplicate accounts in Whisper, the customer service rep couldn't see that on their side. So it caused some confusion for the participant, it caused some confusion for the clinic. And so all of it could have been avoided by searching before adding a new account. Everything on the two accounts was identical. Um, and then finally, if we're not searching for accounts, existing accounts in Whisper, it opens up possibilities for families to participate in more than one agency in our state, which is, you all know, against federal regulations. But if we're not searching, it's a possibility that somebody's participating in District 3 and someone in District 4 could add them without realizing that they're already on the program. And that creates a lot of problems. So let's see. So when there are duplicate accounts, what happens? What do we do about it at the state office? So a lot of times when we get calls about duplicate accounts, staff asks us to merge the two accounts, which isn't something that Whisper actually allows. So when duplicate accounts are created, we only have two options. Our options are to either delete the account or to suppress it. Deleting an account is only allowed in Whisper if nothing besides basic demographic information has been added. So that means like date of birth, name, address, those kinds of things. Kind of the easiest way to think about it is that if any information has been added that has generated a staff note on either the family or participant account beyond just a new participant was created or a new participant was added to the family, we probably can't delete that account. So this means that if anthropometrics, income, and interview, anything has been added to that account, there's now data associated with it, so we can't delete that account. So when we're not able to delete an account, our only other option is to suppress it. So by suppressing an account, we're essentially hiding it. This means that the account still exists, but it's not easy to find unless you know it's there. This is why when we suppress an account, we typically will ask the local agency staff member who reported it to make notes on both family accounts and the participant account about what happened and where to find the participant account. So there are two ways to find a suppressed account. Either you need to search for the participant ID number, which means you have to know the participant ID number. Or if you're on the family account where the participant was suppressed, you can click on that checkbox that says include past participants on the family page, and it will list any participants that have been suppressed. But again, you have to know that they're there and you have to know which family account they're on. And so that's why we always ask, make all the notes on all the accounts when this happens so that staff do know that there's another account and can find it if it's necessary. So obviously, the easiest way to avoid all of this is just to be sure that staff are searching thoroughly in Whisper before adding new participants and families. The Whisper guidebook and the QRCs for adding new families and participants both address possible ways to search for participants. Before searching, we recommend always asking the first card holder if the participants or the family have been on WIC before. Whether their answer is yes or no, you should still search for them just in case they're incorrect, which probably happens a lot more than most of us realize. I would suggest trying at least 2 searches before creating a new account. My go-to search method is searching for first name and date of birth. And that's just because last names change more than probably any other demographic information. And so your first name and date of birth will definitely narrow that down for you in a search. Some other recommended ways to search are by date of birth, social security number, first name and phone number, card number. So if you can ask, do you already have an EWIC card? And you can search for that card number and that will pull up that family. So those are just some ideas. Obviously, any combination of these should help find that family or participant if they're in our database. So really quickly, I don't know whether to ask for questions before I ask this next question. So, do you guys have any questions on any of this?
And Brel, there's one question in the chat that
Mhm.
says, does this apply for PG? I'm thinking a pregnant underage client. It's from Mary.
So if it's a pregnant underage client, that would be the one scenario where we do need to create, like if they were a child participant and they're coming back as pregnant, we do need to create a new account for them just because a child participant and a woman participant are very different in the way that they're considered in WIC and the way they're in the system. So that's the one exception for when we would create a new account.
So, Amberelle, I have another question, kind of
Okay.
expanding on that, if you have a minute.
Yeah.
So if I had a scenario where a 15-year-old came in as pregnant, if she were going to go for medical care of any kind, she would need a parental consent, but we don't require that at WIC, as I understand it. So that 15-year-old would be the responsible adult. And then when she turns 19, she comes back pregnant, we do not have to re create a new number for her, correct? Is that what I'm hearing? Are you there?
Yes. I'm sorry.
Oh,
Did I
I
cut
didn't
out?
hear you. Yeah.
Okay. Let me see if I can figure out how to stop my video. I think my internet is slowing down. Okay, can you hear me all right?
Mhm.
Okay, great. So what we're looking at categories. So a child category is really different from a woman category. So a woman category is breastfeeding, postpartum, or pregnant. And they can be a woman category and be 12 or 30 or any other age. Um, but we're just looking at whether at their category. So if they were a woman category participant at 15 and they come back at 19, we could use the same account.
Okay. I just wanted to clarify.
Yeah.
I didn't know if there was something in the system that identified them differently by age, but not. It's by category. Thank you.
Hmm. Yeah. Okay. So if you have any more questions about this, I'll give you one more chance in a second. But we're talking about the possibility to add a check in Whisper when you're adding new families and participants. And the way this would work is that when you go to add a new participant, Whisper would search the database for a match of that date of birth and that first name, and would generate a pop-up and say something to the effect of, hey, is this the same person? And at that point, staff would have to ask, like, hey, have you ever been on WIC under any other last name or anything like that? I just want to see if you guys have any thoughts or feedback on adding or not adding something like that to Whisper.
Amberelle, I think the one problem we have in District 2 is spellings. Like the trouble with first name and date, if you do date of birth on a baby, it's fine. You get a very short list. But if you do a date of birth on like a woman category, you get this huge long list that's kind of unwieldy. And like any name that starts with C or K. And I do not understand why people do not know how to spell their own name or spell their own child's name consistently, but that is a huge problem we find is spellings. And I don't know if
Yeah.
Whisper can be more flexible because it feels like, like if I type into Amazon anything close to the name of something, something pops up. But Whisper, you got to get the K or the C right.
Okay. I can look into that.
I'm just going to add something to that, if it's okay.
Yeah.
I see issues with the FNU being, whether it's in the position of the first name or the last name, can be challenging, right? For those family name unknown or first name unknown with some of our refugee families, that can be hard if it's not in the right order. I don't know how you remedy that because it's difficult to ask. Is it your first name that's correct or your last name that's correct?
Yeah.
I mean, I think there are definitely some specific cases where it couldn't work, but it sounds like in a lot of cases it would be a great way to just do an extra double check and maybe prevent a few extra accounts from being created.
Thank you. And that's, I mean, we realize it wouldn't be foolproof. We're just trying to come up with ways that we could maybe help remedy as much as possible. We know that things are still going to happen. But if we could decrease the number, that would be good. Okay, so we'll move on to the next topic. Unless, are there any questions in the chat? Let me look really quick. All right, thank you all for your feedback in the chat. Okay, our next topic is entering dates of birth. So this is another issue that we've seen more and more calls about. Like the previous topic, there are several reasons that this is a problem. The first issue that I have related or listed here, sorry, is card related. If we enter date of birth wrong for a first card holder, they won't be able to set a PIN for their WIC card, which means they will not be able to use their card at the store. Hopefully, they would call if this is an issue, but we know that not all families do, and that there are times that families will just not use their WIC card until the next time they have an appointment, and they'll wait until that appointment to bring it up. Obviously, we don't want that to be the case, and we don't want that to be a barrier to them redeeming their benefits. The next issue is, again, similar to the last topic, incorrect data. Well, when a date of birth gets entered incorrectly for a participant, it can throw off growth charts, risk codes, and more. Usually, if the date of birth is off by a few days, you won't see huge impacts in the data in Whisper, but if it's off by weeks or months, it can throw off all of the certification information. So in order for those things to be correct, we've got to be entering dates of birth correct as much as we possibly can. Finally, fixing errors related to incorrect dates of birth is very time consuming. Anytime we have to fix an insert date because a date of birth was wrong, and typically we're not talking by days, we're talking by weeks or months, or sometimes years for adults. When we have to do that, it takes our developer a minimum of an hour to fix things in the database. The longer it's been since the incorrect date of birth was entered, the more time consuming and complicated it is to fix things in the database because we're talking about growth charts and anthropometrics. And so there's just a lot going on there. And because this is happening so much, it's become a really big strain on the time of our development team. And so going forward, we're not going to be fixing anything beyond the basics with an insert date when we have to make corrections because of an incorrect date of birth. So we'll correct the insert date, we'll correct any basics, but we're not going to fix growth charts or anthropometrics or anything like that because it's just way too time consuming. And it's taking away from the other things that our development team needs to be doing. In a future Whisper release, we do plan to have Whisper correct the basics when a date of birth change results in a certification date change, but it's still not going to correct the anthropometrics or other things when there's an incorrect date of birth. So what can we do about it? Always double check dates of birth. You can do this by reading the date of birth back to the first card holder, asking them at the beginning of an appointment to confirm their date of birth, to confirm the dates of birth of any children on their account. check dates of birth against submitted IDs like a driver's license. What we should not do is change a date of birth to match IRIS or Medicaid without first verifying with the first cardholder that their date of birth is correct in IRIS or Medicaid. And that's just because employees entering information into IRIS and IBIS make mistakes too. And sometimes the information in their systems are wrong and ours is correct. So we don't want to be like changing our data to match their systems if their data is wrong. So we just want to always be verifying with the responsible adult or first card holder, sorry, which date of birth is correct. So finally, I just want to be really clear that we understand that mistakes are going to happen and sometimes things get entered wrong. We just wanted to bring these things up so that you guys have an awareness of the impacts that having the information wrong in Whisper causes, and just to hopefully encourage double checking of certain pieces of information that get entered into the system. Do you guys have any questions on any of that?
So if their date of birth does not match Medicaid, they're not going to pop adjunctly eligible. So we're just supposed to have our staff call the help desk to have an override. How do you want us to go about that? Because,
Yeah.
you know, we try to, and it's not usually date of birth, but it's name. I have told my staff they have to go by the name on Medicaid so they're adjunctly eligible.
So, I mean, our preference, and I know that sometimes it's difficult, especially, you know, if the help desk isn't available or whatever, our preference would be that our information's correct. And so if Medicaid has it wrong, that we'll just do an override of their AE, just so that the information in our system's correct.
Guaranteed, this always happens at 5 o'clock or 4 o'clock on Friday and you guys aren't open.
Yeah, no, I get that. And if you do, in that case, Angela, if you guys did change it to match Medicaid, if you could just, you know, let us know on Monday or send us an email or something so that we could fix it, you know, change it back and override or whatever, that would be great. Because but when we do find those discrepancies, it is good to let the participants know, hey, Medicaid has your name spelled wrong, or Medicaid has your date of birth wrong, so that then they can address that with Medicaid or whatever program has their information wrong. Okay, let me check the chat really quickly. Okay, Jessica, I see your comment about names, and let me think about that and see if there's anything we can add to Whisper for some of those issues. Okay, if there are no other questions on that, then I will go ahead and hand it over to Teresa.
Can you guys all hear me?
Yes.
Okay, I'm going to share my screen. Just give me a quick second. Can you guys see this okay?
Yes.
Okay, perfect. So the first thing we wanted to kind of talk about is just let you guys know PediaSure is going to be changing the size of the PediaSure with fiber from 8 ounces to 7.4 fluid ounce containers. And this will be for all the participants. So we just want to let you guys aware that it's nothing else is going to change about it, just besides it's going to be a little bit higher calories, but that's okay. And the rest of the nutrients, all that stuff will remain the same. So you will start to see, and participants might start to see the new sizes in stores. And just to show you, we have, it's basically the same exact thing, PediaSure Grow and Gain with fiber, and it's only the with fiber ones, and then 7.4 ounces, the chocolate, the strawberry, and the vanilla. So that's the quick little one. Is there any questions on that? And I can't see the chat, so if there's any comments, if someone wouldn't mind saying what's in the chat.
I don't see any in the chat.
Okay,
Teresa.
perfect. If there's no questions, then I can move on to the next topic. So the next topic is going to be guidebooks. Super fun changes. Let's see if I can get that out of the way. Okay, perfect. Okay, so here's the index of change. We've made a lot of changes on the guidebooks. We're going to go over the major ones. Some of the major ones we've already discussed on other calls, like nutrition risk code changes or the hemoglobin changes. So basically all the changes that were discussed in those ones have now been incorporated into the different guidebooks. So the index of change is going to show you basically the website, the folder name of where you're going to think. There's actually a current link here, and it'll tell you which guidebook, the learner, the trainer, and if there was activities added, and then what was actually changed. So one of the ones I am going to show you is going to be the referrals guidebook, because we added the section on abuse, and then we added another section, an optional section of taking care of yourself, and that was also part of the nutrition risk code changes. And we also updated information on the blood-led referrals with the 211, again, nutrition risk code changes. I'm going to show you that one now. So this is the part that's the major changes, the blood-led testing. We've included ways that staff can actually ask. We've included ways that staff can actually ask the questions, so, or get the information. Like I hear you say no or don't when they ask that question. If they've had a blood test, can you please tell me more about this? And other options are the same ones. And then based upon what the participants' answers are, here are some possible answers that staff could actually ask and how to follow up with it. So we know that some medical providers don't conduct this test, but you may want to check and see if it's right for you. And all of this stuff, again, is in that training that we did previously. I just incorporated it into the guidebooks. And then if they've had the test, little examples of what staff can say and just other little answers. So that's the major part for the blood lead, and this is going to be in the referrals guidebook, since technically we're doing referrals for blood lead. And then this was updated with the 5 for women and infants, and then the 3.5 for children. The next part on this one, and if there's any questions, please feel free to stop me at any point and ask whatever questions you have. Is going to be the abuse section. So this section is a brand new module and brand new section to the referrals guidebook. We've included the materials that we had in the nutrition risk code changes into the guidebook now. So why we care about abuse, there's the how to screen section. So that whole part where we talked about if we can actually ask the question, checking for other people in the room, if we're doing phone and or video appointments. We screen everybody except those that have people in the room with them, so we wouldn't ask those questions. The fact that we have a new answer of unable to ask the question, this part is in here as well, so that way we know if they have someone else in there, we're going to use that new answer selection of unable to ask the question. How to introduce the question of, we talk about sensitive questions. May I ask these questions? For the next question, we're required to ask this to everybody. And then the section talks about what happens if a participant says yes. If they don't want to share, it's okay. And then just little things the staff could say if they don't want to share, making sure that we're asking if they're in immediate danger. And again, all these are samples of different ways that we can ask these questions. Do they need help? Provide the referrals as needed, and then report as needed. And we have added a new activity to this one as well. So this will go through some of the activities that we did in the other trainings. We've incorporated that in there. And then we've included tips on how to talk about abuse with the victims. Again, all this is from that training as well. It just kind of goes through it. And then we have an optional module. This means you do not have to have staff do this. This is just there for an additional resource if you need the additional resource. And this one's of taking care of yourself, where it talks about the compassion fatigue, the burnout, all the things that we had talked about, and then resources of different ways to
like free resources for getting counseling sessions or learning about a trauma, learning about other kinds of things, burnout, compassion, fatigue. Is there any questions on this referrals one? And what was added? Okay. I'll close that one. The next one that's going to have quite a bit of changes in it as well. This one looks like it's a lot. This one was just basically the eligibility one. It's actually not too much. It was basically just making sure that everything in the policy is updated and matched in the guidebook. So that's why we've got what this was added, the proof of identity and photo ID, current passports, driver's license, immunization record, the iris, that kind of stuff. So all that was added to this. And then updating like a name of like a QRC. So it looks like there's a lot in this one, but it's just making sure that the policy and that is in there. And I see there's can someone read that question? I apologize, I couldn't quite read it the whole through.
I don't see a question. So if there is one, it may have been sent to you directly, Teresa.
Okay, so sorry. I'll look at that in a second then. Okay. So the next one that we're going to talk about is going to be the basic. Nope, that's not that one. Food package, issuing. Okay, hematology. That's the next one with major changes. Okay. With this one, since we had those changes to the hematology and being able to offer them, we don't have to offer them to infants, the premature infants. We only have to do it now on a case-by-case basis. This was updated in the guidebook. We've also updated the procedures of how to do it, and it shows that we're doing in the finger, or for an infant, we're going to do it in the middle finger or the heel. So all this stuff that was in that was updated in the guidebook. And it also has the lancets and the testing sizes for the finger puncture depth and the heel puncture depth as well. For an infant, the less than 9 months, then the infants 9 to 11 months, and then children 0 to 5. So making sure that we have those lancets. And I know, Cheryl, you'd asked a question on the lancet size on one of the previous calls. I have reached out to HemaQ a few times. They still have not responded, so I will reach out again to get that question answered that you had when I did this training, I believe. So I'm still trying to figure that out for you, Cheryl. So then the next part, it goes through the micro cuvettes, and this one will go through the HemaQ 2.0, the HemaQ 3.0, the analyzer, and then we've got a cleaning section. Then we've got an optical parts cleaning section, then the cuvette holder cleaning part of how to clean this, and then the same thing with the other one. There's a troubleshooting section now for how to troubleshoot, and more troubleshooting for the other one. And then we've got copies of the user manuals in this as well. We've added a section called proper hand hygiene, and it talks about alcohol-based hand sanitizer versus soap and water, and of when to use either one, and then how to actually use the alcohol-based hand sanitizer and how to wash your hands with soap and water. So we've added both of these sections. And then this part was, I think, already in here of how to obtain a good sample. So nothing was added to this section, except for changes would be the heel stick. So we still got pictures of the heel stick, puncture sites, making sure it's a lateral, if it's a finger, the middle finger, or the ring finger, as long as there's not a ring on the ring finger. And so on and so forth. And then the rest of this, I believe, should be the rest, and nothing has changed on the rest of the guidebook. That what was in there was already in there from before. So is there any questions on the changes to the hematology one? And if people have questions, feel free to just speak them out, since I can't really see the chat. Okay. The next one with major changes is going to be the Health and Nutrition Assessment Advanced Sample. That one is, okay. So for this one, we've incorporated, thank you, Cheryl, I just saw that one come through. So the Health and Nutrition Assessment Advanced Sample one, we've got, we've incorporated the new screenshots of the computer system to show the questions that are currently in there, and it shows the reminders that are in there, but we've also added a section for when we're doing the discussion piece on how to provide the nutrition education of actually how to do a sample of how to provide the substance use information when the information is accepted, and then also when the substance use information is declined. So for this exact example, for I believe this is peach and plum, plum smokes and or vapes. So we've actually have her assigned the nutrition risk code, and since she has been assigned a substance use nutrition risk code, we have to provide a referral. If she did not have a substance use nutrition risk code assigned, we would not have to provide a substance use referral and would only have to provide that quick tips sheet with minimal substance use information on it. So this is just kind of ways that staff could possibly have a conversation is what we're hoping this will help with. And it talks a little bit about it and just gives an example of what the WIC staff might say, what the participant might say. And that's kind of some of the major changes in this one. So basically trying to incorporate all the other changes from the ME into the guidebooks further. Any questions on this? Okay, I'll move on. Okay, the next one is going to be the basic nutrition learner, trainer, and activities. That one's got quite a few changes as well. And then one thing I did kind of want to point out that I probably should have at first is we have also made a little cosmetic change on all of the guidebooks as well. So on all of the learner guidebooks, you're going to see the front page, everything's going to be green. The sign's going to be green, the title's going to be green, this part's green, and this part's green. On all of the trainer guidebooks, I'll just open up this one. Everything's going to be purple. So that way it shows a difference between them. And then I just saw, can someone read that question that popped up?
Yes. Do we need to select smoking or substance abuse from education topics if they don't use them, just for screening the questions?
So we still need, since technically we still have to provide information, that is going to be an education topic that we will select under our education topics. So it'll be either, you could probably, if you're just basic, I would probably just do the substance use one, and that way we would probably cover your smoking cessation. I would be more, if they're smoking, then I probably would be more specific and do the smoking cessation under the education topics, if just to kind of be more specific on what's applicable to that person. But if it's just like a basic person, they're not doing any kind of substances, smoking, whatever, just make sure it's still documented so that way we can show that. And I can actually show you an example of that. We have examples of that in the sample. I'll make it a little bit bigger. This person is Apple Blossom, and Apple Blossom does not do any kind of substances, and these are her risk codes. I've included substance use under an education topic, and then under the handouts, I put on here quick tips, substance use information, no referrals, and the fact that she declined the information, did not want it, I put declined in there. So that way we know that we offered the quick tips and the person declined the quick tips, but I still offered it as an education topic because it's one of our mandatory, we have to provide the substance use information. So I hope that explains what I just said and hope that answers your question. Okay. Okay, so now back to the substance use. Okay, and so for this one, we've incorporated all the changes and all the things that we've learned from Randy Pedersen about substance use. So starting the tone, explaining why we're getting the information, providing assurance and truthful answers, and then ways that people can ask the questions, and then asking the screening questions, offering the applicable information sheet, and using our PCS skills to take affirmations, reflections, all that kind of stuff, and different ways that we can say it. And then we've included the samples that we had in the training as well of putting it together when somebody says yes. So here's what the WIC staff might say, here's what the participant might say, and then what we might do and how we might answer the questions. And then when we're actually providing the nutrition education, here's how someone may incorporate the stuff in there when somebody says yes and they are willing and open to the information. So just different ways we could say it, and then the information sheet that we need to provide, the fact we were going to do the referrals, and then when the screening questions are answered no and the nutrition risk code is not needed, then we can provide the quick tips. We do not have to provide referrals. We only have to provide the quick tip sheet, and then ways that we can say it. And then when providing the nutrition education, a way staff can say things. And then we've also included if somebody declines. They've declined, they don't want to answer the questions, and just different ways to say it as well. And then when providing the nutrition education, and we've also included a little section in there for health screens. So if they're screened as low risk at a certification appointment and the quick tips education material was documented as offered, and they remain at low risk at their health screen on the next appointment, we don't have to offer that quick tips again. We just have to basically make sure we're asking them, has there been any changes in your alcohol, tobacco, drugs use since we spoke last time? If they say no changes, staff can move through the substance use questions without asking them again. Just make sure you document those answers, the same answers from the previous certification appointment. So that will hopefully help speed things along at health screens and still make sure we're screening for our substance use and providing and offering information when it's needed. Any questions on this? And I've got 10 minutes, so I've got to hopefully get through all this.
Teresa, you have longer because we had extended this call
phew,
and then
okay.
Kristen had to reschedule.
Okay, thank you. That makes me feel better. I was like, I gotta fit this in here in 10 minutes. Okay. There's no questions on that one. I'm gonna show you, the next one is the postpartum. Okay, so for the postpartum, with exit counseling, we've included and added a new section for how to offer exit counseling. And with this one, we've tried to provide different topics and different ways people can say and which ones to do. Like say someone is switching from a prenatal to a postpartum woman, a B or an N, staff could say, and we've got the little thing here, and then it tells you which education sheet to offer. So for this one, we might say we want to offer you tips and tricks that may help you with your postpartum needs. So we would offer the Stay Healthy, which is going to be the one that we could give, because that way it's going to be more applicable to the woman, because she's going to be changing and possibly breastfeeding and that kind of stuff, and possible issues with postpartum depression. So just making sure that it's applicable to the woman's need. Then if somebody is leaving the program after being postpartum, staff could say, I'm not hearing you say anything, if any specifics that you would like to discuss. I have some information that I'd like to offer you, tips and tricks that if you ever decide you would want another child. So we're going to offer this, and then if the participant declines the information, make sure this gets declined. And we do have, I believe we also added, okay, so I think that's the section that we added for that one, it looks like. So, okay, perfect. Is there any questions on this? The exit counseling, and this one was added to the breastfeeding one. So the same section part's going to be in your breastfeeding one, and it's also going to be in your prenatal one as well.
Teresa?
Uh-huh.
So going from pregnant to breastfeeding or non-breastfeeding is the Stay Healthy, not the healthy pregnancy.
So you could do either one, but we just thought it would flow pretty well if we tried to offer like the Stay Healthy one. But if you would like to do the healthy pregnancy one, you can always do the healthy pregnancy one and saying, if you ever decide to become pregnant again, and just kind of reword it however you guys are wanting to offer it. So if you want to do it that way too, it could be, if you decide you want to become pregnant again, here's some tips and tricks for a healthy pregnancy in the future. So technically it could be either way. We just thought this would flow pretty well if we did it this way.
Well, yes, it does make more sense to me. I feel like I had it in my head the opposite way and it never seemed right. So
Okay.
thank you.
Yeah, not a problem. Any other comments, questions, concerns? Okay, so I'll move on. So the next one I'm going to show is going to be the child one. And with the child one, there isn't too many changes, but we did want to kind of just point out and share that we have created an optional module number 4. So again, this is not something that is required. It's only if somebody wants additional information. And with this one, it's a video on child nutrition for kids with special needs. And this is from Minnesota WIC. It's a great webinar. It's pretty long. And it talks about these topic areas: children with special needs, and then nutrition for children with special healthcare needs. So again, not required, only if you want to. And that's pretty quick on that one. Okay, this next one. Okay, this one's pretty fun. So we are in the process of, we would like your feedback on this, and we have created a prenatal guidebook that is a completely different format than what we've done before. We have adapted this from Colorado WIC. We've had a couple of the coordinators review this before time and give us some feedback before we decided to test this. So we are testing this. So the prenatal guidebook that we've had before, you're not going to find the prenatal guidebook in the activities section, in the activities guidebook anymore. You're not going to find a prenatal trainer guidebook anymore. You are only going to find this one guidebook, because all of the guidebook, the learner, the trainer, and the activities are going to be included within this one guidebook. It is long, but there are no videos. It's just basically reading. So this is going to be a test. If you guys like this kind of format, then we'll try to format the other guidebooks and do a revamp and work on getting them closer to this format. So please let us know after you've done trainings for the year if you like this kind of stuff. And at the end of, after I show you all these changes, I'll let you know when we're implementing and all that kind of stuff of all these guidebooks. So for this one, there's a lot of awesome sections in here. So importance of prenatal care, anthropometric indicators, dietary indicators for nutrition needs, special concerns during pregnancy, clinical indicators of nutritional needs, social indicators, WIC prenatal steps. The exit counseling is within this. So we've got our state exit counseling within that section, and we do have the substance use in this one up here. I believe special concerns during pregnancy. So the stuff that's in substance use in our normal guidebook was moved over into this section as well. So like I said, this one is very long, but we're hoping that this will be easier. And if you guys like it, we can definitely work on trying to adapt the guidebooks to more of this kind of style. So, and one of the kind of cool things about this is it does, as you go through, it is going to walk you through the different risk codes that are associated for women and tell you if it's low risk, tell you if it's high risk, and the definition, that kind of stuff, and it gives you a little bit of information on that risk code and why we have that risk code and all that, and then goes through the rest of it. Here's a self-check practice your knowledge area. There's that, and then the answers are right below it, but we do ask that people try to complete it themselves, but yes, the answers are still there within that as well. Any thoughts or feedback right now?
This is awesome, Teresa. I just have to say thank you. I'm wondering if these are going to be accessible to us right away, or you mentioned a trial period and then they're accessible. How will this be open for us to use?
So right now, I guess I could just mention that right now if that works perfectly fine. So what we will do is we're going to update the guidebooks on the website on May 31st. So that way June 1st is the date that we're hoping people will start to use the new guidebooks and the updates and all of that kind of stuff. So basically kind of make that determination if you've got like multiple new staff starting and maybe one of them starting May 28th, and then maybe you've got another person starting on June 2nd and you want to use the old guidebooks. It's okay to use the old guidebooks to kind of get you through, but then especially if that person starting June 2nd, but try to get people using the new guidebooks June 1st. So this one and all of these changes will be uploaded to the website, like I said, May 31st for use. And this is the only one, this prenatal nutrition one is the only one in this format for right now. So that's why this one is that test trial period. And then basically on probably a future training call or NEAT call, whichever call we decide to do it on, we'll ask for the feedback and say, how do you guys like this? And then if you guys like it, we'll work on making the other guidebooks like this one, versus if you liked the other format, we can always go back to the other format. If that answers your question.
Yes, it does. Thank you so much.
Okay. Okay, the next one that I wanted to share with you guys is going to be the baby behaviors trainer, learner, and oops, that was supposed to be activities. I apologize. Okay. Baby behavior. So this one's a really, really quick one. This one's another one that we've added optional modules as well. Infant feeding practices videos. These ones go through nutrition from birth to 24 months, introduction of solid foods and food allergies, progression of solid foods, baby-led weaning and raising an intuitive eater, and then heavy metals in baby food. So all of this kind of stuff is talked about in these infant feeding practice videos. And we've also got Dr. Yum's First Food, a baby food adventure webinars as well. And this one goes through the first food adventures, module 1, 6 to 9 months, the second one, 9 to 12 months, and then module 3, 12 to 24 months. And you have to register to be able to view these ones on the site, to view these videos, which is why we're making these ones again as going to be optional. So you do not have to have staff complete them. They're just there if people want additional resources and they want more information. Okay. Is there any questions on that? Okay. So the rest of this, the index of change is going to go through and tell you what was changed, what was removed. If we replace terms like substance use or substance abuse, whichever way we did that, if we updated the exit counseling modules, if we just formatted the learner and the trainer to make it more distinct, whatever the case may be, it goes through this, and this one will also be added to the website as well. There is one other thing that we are adding that I wanted to talk about, which is going to be to the training checklists. So on the knee call last month, we were asked to give some tools to help the staff navigate the website, navigate nutrition education materials, and then just kind of in general, how to share the education materials. So we've created these 2 documents, which will be linked into the checklist for future purposes and staff training. And then we are also going to be sending these 2 documents out, this nutrition materials pathways and this navigating the Idaho WIC website with the minutes as well. So we'll get these sent out to the local agencies. So in this document, just to kind of like how to use this, these are all linked. So each one of these is linked to different parts of this document. So the nutrition education materials available, I'll click that link and it takes us to this page. And for this page, all the materials are going to be available and it tells you in English and Spanish. And then refer to the quarterly order form to see documents that can be printed. You can click on the title for the links to the folders where most of the materials are found. And then if a material can be found in another folder, it's identified and there's a link next to it. So for example, we see the 0 to 6 months, the infant nutrition folders linked. So that's the document that we had before, which was the 0 to 6 months. So now these are all the materials that are replacing that 0 to 6 months. And same thing with the 6 to 12 months. Here's all of the documents that are replacing those ones. And we've got like the peanut allergy one. And some of these documents you're going to see only digital. Like you're not going to see this Help Me Be Healthy printed, but we still do have a Help Me Be Healthy from Maryland WIC in there. And we've got eating tips from Dr. Yum, which is in there as well. And then the IM1 goes through the same thing. The nutrition folder, or the toddler nutrition folder is linked here. So all of these are links. Takes us right to the website for all the materials. And as you can see, Camilla has started changing all of the names from, here's the English one. And then to identify the same one, we're still keeping that first couple things that, so we see how it says BFC, so we know it's going to be the same one. And then here is the Spanish title. So if you send these links over Teletask, it's easy for the Spanish person to identify that it is the correct document that they are looking for. Same thing with the IM 2 to 4, the childhood nutrition folder. And then all of the documents in that you will find within that. Then we've got an adult nutrition section as well. And you can go to the nutrition section. Here's all the documents that you're going to find on there. Again, if they're in other folders, they're linked here. And then we've got even a section, since we do have the remote services tools on there as well, we've included the links to the education choice folder and a link to the WIC Smart folder as well. So that's the education material. So that's that first little part here. The next one is going to be using the website to find nutrition education materials and how to actually navigate it the best. So how do we search for the materials? We're going to start with the link. Here's the link. Then you're going to select the folder that you want to search in. So we see a picture of, after we click on the link, all these different folders are here. And for the purposes of this example, I chose toddler nutrition. it's going to show in red. So we see that it's going to show up here in the navigation. And then this is mentioning that talks about the English and the Spanish versions are going to start with the initials to help staff identify the correct handouts. And then the Spanish titles are going to be in Spanish. Then next, you're just going to select whatever document you are looking for and click it. So see how the document name shows up in the navigation tab. So this green box. So this is how we know which document that we have open. And this is actually linked to that same document you want to see. BFC, baby's first cup. It's going to take forever to load. There we go. And then to navigate back to the toddler folder for other documents, there's two options. The first option is to click the toddler nutrition in the navigation bar. So either clicking here, or you can click up here in the toddler nutrition in the top tab. That's the other option. And then to navigate back to other folders, click the Any Materials in the top navigation bar, and that's going to display all of the folders that you can choose from, and then you can navigate to other folders within that. So, and then I guess I'll stop. Is there any questions on this part? Okay. If not, I will move on to the next section. So the next section, all the way back up here, is basically nutrition education materials, teletask functions, and all of these are linked. So say someone only wants to do what's the best way to send it over teletask. Each one of these is still linked, but I'm just going to go through this because I'm going to go through all of it. And then here's the nutrition education materials and teletask function. That first question is, how should the link look, and what if the link isn't working when I try and send it over teletask? So links need to end in public documents and just a period like this. So here's an example of public documents. There's nothing at the end. We don't have anything weird at the end. If there is anything after the S in this little box up here, it's not going to send right over teletask. It also won't send right if you send the link in emails, anything like that. If there's anything after it, which we see an example here of and CR equals 1, this will not send right over teletask, links, emails, anything. So we want to make sure that we get rid of anything that is after this S. So the two ways to correct a bad link is either simply deleting anything that's after that S. So we could just delete the and CR equals 1. Or what I just find the easiest is to click on one of the folders from the list and then click this Any Materials in the navigation bar, and the page will reload without the and CR equals 1 at the end. And then you can navigate to where you want to go, and happy clicking on that one. Any questions on that first part?
Teresa, where is the public documents located?
I'm not quite sure I'm understanding what you're asking.
So when you look at your address,
Uh-huh.
you have it under the public documents.
Okay, yeah,
Is
so
that
this is going to be the link that we're going to send you. So all of these are going to be linked here. So this is how you're going to get to that. It's just by clicking this right here, and it will take you to this part here. The other way that you can see it, for example, if I'm on just the normal website, the normal website looks like this. When you click on Formula Handbook, we'll say, for example, I'm just going to click on calculation, guidance, and examples. And I believe the navigation one will also help explain this better too. This right here is the bar that I'm talking about. So for calculations, I can click on this right here. I can click on this, and it's going to take me to other documents. I can go to this. It's going to take me to folders. So it's just kind of like this little navigation bar right here.
Okay. Thank you.
Uh-huh. And we'll go down to the second one. Okay, so then the last question on this particular document is, what is the best way to send nutrition education materials over teletask? And for us, the best way is to send them via links and not attaching documents to teletask. And the reason why we say this is because sometimes if the document is not converted to a high enough quality, it will look black when a participant tries to open the document and it doesn't come through very pretty, or it might not come through at all. Sometimes if it's 4 pages, it will look like it goes through on our end on teletask, but then the participant will never receive anything. So, and it's also going to be dependent on cell phone service. We've seen more of an issue with Verizon than we have with like AT&T and Sprint. So, unfortunately, it depends on all of that kind of stuff, which is why the best way that we found is to just send links and not actually attaching a document in teletask. And when you send a link, the document size doesn't matter, the page number doesn't matter, anything like that does not matter. So the best way for us to do is to send how to send these over teletask is we're going to do copy, control C, the link displayed in the address bar at the top of the web page that you want to share. And again, make sure it does not have anything after that S. You're going to copy that. You're going to press paste, control V, the copied link / URL in the message box in teletask, and click send. And then the last part of this, we recommend sending any kind of personalized messages before sending any materials so our participant knows to expect a link and that the link is safe for them to click on. So I've got a sample here. Hello, Sally Jones. We talked about weaning Joe Bob from the bottle today. You asked for us to share education materials over teletask. I will get you a link to the document sent after this message. And just kind of a little message there. And that's this document. Any questions on this document? Okay, so the next one is just basic navigating the Idaho WIC website. So for this one, here's the table of contents. All of these are hyperlinks as well. And it's going to talk about basic functionality of the website, what staff might find in the WIC vendor section, what staff might find in the WIC partner section, the breastfeeding section, and then the WIC staff training and resources section, QRCs, training resources, other training resources, and finally, the WIC staff section where the forms, the formula handbook, policy manuals, nutrition risk codes, and WIC coordinators. So everything in here is linked to an actual document. So you could have this maybe somewhere in your guys' clinic if you want to utilize this tool, and staff may have an easier time finding LOIs, Cs, OIs, RRCs, VOCs, whatever the case may be. So I'm going to kind of show you the basic functionality one first. Okay. Well, here's the introduction. I guess I should show you the introduction, might as well first. So tips to using the guide. This one that kind of gives you tips. All the colored green, red, and purple words are linked to the website. The WIC website is broken down into different categories depending on the audience. We've provided a link to the participant page and to the provider page. And here's a way to get to the provider page. So the basic WIC website, how to find it, providers, public assistance, the program WIC, or here's a link directly to the vendor page. So for providers, public assistance program, WIC, right there. And then it tells us the local agency is considered a provider of WIC services. And this resource will focus on the provider side. And then it tells us that there's 5 different sections that we are exploring. And here's the first one, basic functionality of the website. So helping us identify which section we're currently in. The WIC website you'll see is in blue. So that's how we know that we are on the staff page. To move between sections, just have to click on a different section. And then opening a document within a next section is going to expand the folder. So we've expanded the formula handbook. We click on a document. And for this example, I use the calculations guidance example in the formula handbook. I'm going to click on this one. It's going to open in a new tab. And here's that navigation bar that we were just talking about right there, that public document. I can click that one, it's opening there. If I need to navigate back to the WIC staff page, we can do it one of two ways. We can either click on this one here, so I can click here. That will, right there, we can see the WIC staff page. I can click there, or you can click down here for more formula handbook needs. So, okay, let me see hold on. We'll open in two tabs. Okay, first one of two things. I think I didn't move down far enough, so I'm sorry. I also wanted to mention here, we do have multiple documents in the formula handbook are open in different tabs, so you can do that. We've got the calculations one open and the formula nutrition issuance one open. So any new page is going to open in its own little tab. Or other way to kind of say we're done with the documents, I'm going to close this one, and if I want to close that one, then this is the only tab that's left, and that's going to be the WIC staff page. So everything left right there, WIC staff. So we don't need a document open, or we need the document open. So I guess, let me back up. If you need another document and you still need this one open, you're going to click right here. If you are done with whichever document that you opened in a separate tab, like we're done with the calculations one, we don't need it anymore, but we need another document in the WIC staff page. That's when you're going to do this one, number 2, and you're going to close this one. And then this is the only thing that's left is the WIC staff page. And that same principle is going to apply to all sections. So if we're in the WIC staff training and resources section, say we have a breastfeeding guidebook open and we have a breastfeeding QRC open. We don't need those anymore, but we need another document open in the staff training section. We can just close it that way. And I can just show you on the website really quickly. So WIC staff page, I'm gonna move it down a little bit so you can see better. Can you guys see my little top thing, or is there a bar in the way? Because it says on mine sharing screen. I want to make sure you can actually see what I'm doing.
We can see your search bar and the tabs.
Okay, perfect. So for this one, I'm going to open up frequently asked questions. You see how it pops open in a new tab? I can either close it on the side, but if I still want to open, I can go back here and then I can click modules. And I can do the same thing and keep going down, clicking there, but say I don't need this one open anymore. I'm going to close this one, and then I don't need this one anymore, close that one, close all the ones that I don't need. So it's basically one of two ways to kind of navigate back and forth if you still need the document open or if you don't need the document open. So that's what that one was talking about. Okay. Okay. This next part, so this one I'm not going to go through as in depth. I'll let you guys look at it. It's just going to go through each of the sections. And for example, this one's that WIC vendor, and it just tells us what we're going to find within the section, what resources staff may find and useful in these sections, and then just different browsings. And it goes through, like I mentioned, each of the sections. Here's the WIC partner page. Here is the breastfeeding page. Here is the WIC staff training and resources page. All of these are links. So that's a link, and it links us to every single one. Training resources, all that kind of stuff. And all of these are links, and it tells us a little bit about what's within each one of the folders, how this one contains like the assigned benefits, issue benefits, food list, food package, special off guidebooks, and various other food benefit resources. We've got the NEAT call minutes and resources linked, the training call minutes linked. And then last but not least, the WIC staff section. And these ones are just all of the forms and all that kind of stuff in here. Policy manual, everything is linked within one document to hopefully help us navigate the website. Okay, that was the last little bit. And this is the last little thing that we've added. Like I said, we're adding these to the training checklists, which is why I'm mentioning it with the guidebooks, because training checklists go with the guidebooks. And those ones were updated. Any questions on these?
Teresa, thank you for the teletask help. I think that's kind of where we are, is the new stuff, that it's nice to include that education for the new stuff when you have longtime staff members. So thank you for the teletask help.
Yep, no problem. Well, and thank you guys for asking for these resources. So we wouldn't have developed them had you guys not asked for them. So thank you for asking for them, guys.
Well, it was just done so quickly. This was a pretty amazing, Teresa, and I echo Angela's sentiments. And just having that navigation piece through all the various WIC websites and WIC pages is super helpful. So thank you.
Not a problem. Okay, then back to you, Ambrelle.
Okay, thanks, Teresa. I'm going to go ahead and stop the recording really quickly.